Welcome back to Jeff Koinange, live here at Citizen Television. Live in the studios, Health Cabinet Secretary Mutahi Kagwe answering the questions. I know you have plenty of them. A moment ago, he talked about reforms in the healthcare sector. And I was talking about NHIF. You know, what was it, a month ago, you said or your PS, or PS stated the government would pay for the cost of Kenyans to go for COVID tests. Now you're saying NHIF won't cover. Well, I mean, why should we bother?
Well, because life is not just about COVID. People actually go to hospital, Jeff, because of cancer. People go to hospital because of other very, very many diseases. And let's get this thing straight. First of all, it is not true to say that NHIF does not cover COVID for everybody. I've just told you, for example, that it covers COVID for the health workers, and all that kind of people, civil servants, everybody who has been covered by the government. And what we have had to do, let's never forget, NHIF is an insurance company. It is not the only insurance company that runs away from pandemics, because the whole theory of insurance is on the basis of probability. And if there is no probability, it is a fact. It ceases to be an insurance. It begins to be a fund for simply disbursing money. And what we have been doing as a government is this. The people who have come to Kenyatta National Hospital, who have come to KU, who are in county hospitals, who can't afford to pay for themselves, Jeff, they are not in hospital. They have been released. They are home. We have had to write off all those debts. I mean, people come to a hospital and they are sick and insurance can't afford it. What are you going to do? You're not going to keep them there forever. But on the other hand, there are people with insurance companies and to get insurance cards that pay. You know, that pay for them. And today, for example, there was a debate in Parliament. The NHIF CEO was in Parliament today discussing with parliamentarians what would it take in terms of additional premiums to ensure that every Kenyan who have got an NHIF card is covered for COVID-19. And that's what we are trying to do.
So what would it take? What would it take?
Well, money. Money, which the Health Committee of Parliament was today given a number for them to have a look and see whether we can put that in supplementary figures so that we can cover people. In the meantime, the government itself, rather than say it is NHIF that pays for these measures, in the meantime, we pay for it ourselves. Because it is not insurance anymore. Given the efficacy of the whole situation, it is not an insurance. And it is so important for us to understand the difference between an NHIF insurance cover and a pandemic in which the government has to foot the bills. So in this particular case, what we have been doing since March is not new. Since March, we are the ones who have been paying for it. And Jeff, I'll tell you something else too. If, for example, people, the Camry came here today to start taking your sample, anybody else's sample here, because it is a targeted testing situation, they will not charge you. They will not charge you for it. You don't pay. All right? Yeah. But if you decide as an institution, for example, that you want to carry out tests, not because you have got any reason for doing so, and you go to Lancet or you go to other labs, you will pay. But where it matters, when we are target testing individuals, there is no pay for that.
So I, as in Wanjiko, can walk into any health center, get tested?
If you have got the symptoms, for example, or we think that you have been exposed, and you come to hospital, you come to Camry, you don't pay.
You don't pay?
You don't pay. If you come as Citizen TV and tell us, look, we want to carry out tests just to see whether we are all okay, then you pay something like 2,000 shillings at Kenyatta, and you get tested. If you are a huge organization and you've got the money, and you want to go to private testing facilities, then you pay more. We don't control that. We control what is in the government. But having said that, we have also asked the private sector, private labs, not to take advantage of a pandemic like this one and to charge reasonably. We understand. You have got rent to pay, you have got staff to pay, but yes, you can charge a fee, a small fee over and above the cost. And by the way, Jeff, it is not cheap. Testing is not cheap. It costs anything between $20 or even above for one test only. So that when you go and do the first test, it will cost something like 2,000 shillings to the government, or 2,600. Now you just announce the dollar rate.
Yes.
We are importing all those things.
Correct.
So it costs that much for one test. So you come and pay 2,000 shillings. You come and we spend 2,900 shillings on you. And that time you test positive. 7 days later or so, you decide, now I must have turned negative. So we test you again, and we pay for that too. Then it turns positive again. So you come a third time to prove that you are negative. And we pay for those reagents once again. So easily, you know, the government will spend 8,000-9,000 per individual before an individual moves from negative to positive. That is not even adding on to the people who are, say, at KU, when people come and tell us, look, you know, these people need to be released because they can't pay. And we have got proof from the chief, from the ward, that this person is not able. What do? You tell the hospital, release those people. And the government will have to compensate them, because the hospital still has to pay for its staff. The hospital still has to pay for those reagents. The hospital still have to clean those places. So it's not as simple as it seems.
Tell me something. A lot of Kenyans don't even want to go for that first test. And they get sick, and they're out there in mashinani, and one thing leads to another, and a lot of people are dying, let's face it. A lot of people are dying. Do you think in some way you're throwing your hands up and saying, you know what, I give up?
Never. Jeff, never.
You're not saying if you're going to die, you're going to die.
Never.
You're not saying that?
Never. That is not going to happen. Not under my call. That is never going to happen. If you feel like that, you quit the job. But you can't stay in a job and surrender. You know, this is a war. This is not a time for the weak and meek, you know, who want to give up. This is not a time to give up. This is a time to fight. It's a time to regenerate ourselves and to say to ourselves, we must move together as Kenyans. You know, one Kenyan dead is one Kenyan too many. Let's all go together. Yes, it is not difficult. It is difficult. It is not easy. It is challenging. People are losing jobs. People are losing means of life. But this is not the time to give up. What do you mean give up? When you give up, what are you saying? You are saying we die. How? How can we say we die? So as Kenyans, we must be honest with each other. We must tell people the truth about what is going on. We must tell them, yes, this is a very dangerous situation we are in, but it is not the end. We have survived better than most countries on earth. You know, and when you look at what is happening in Europe, and you consider, for example, a nation like Italy, you know, they have lost over 40,000 people. Yeah. You know, our population are not very different. So when you consider what we have done, it just takes a little bit more effort. And Kenya can be a fantastic example about how this can be managed. So this is not a time to surrender.
Would you tell the
forwards ever, backwards never.
Sure. What do you tell the critics who say, you know what, it looks like we're going the way of Tanzania? Wale watakufa, wacha wakufe, sisi tuendelee.
You know, I am not going to talk about Tanzania because I know nothing about Tanzania. Right? I've not had a press conference about COVID in Tanzania, so I can't talk about Tanzania. I can only talk about Kenya. And one of the cardinal things we have said is we must say the truth. All right? When you say watu wakufe, it means you don't test, you don't stock the hospitals with beds, you don't do isolation, you don't build capacity, you don't put ventilators, you don't put oxygen in hospitals because there is no COVID. All right? But for us, we know there is COVID. We acknowledge there is COVID. We know that we will lose people unless we do certain things. And I think, Jeff, you know, there is a time, and you know, there are so many of my friends who have been in these hospitals, and I've got good friends, even as we speak, who have been sending me messages and telling me, thank God we made some certain measures to save people's lives. People who are in oxygen in KU, people who are in oxygen in Kisii, you know, people who are in oxygen in places that never had oxygen, friends of mine like DCs and DOs who have recovered in places like Mombasa because Governor Joho put in oxygen in the places. These are lives that we have saved. Let's for once not just focus on the negative, on the negative, on the negative. Let's for once see things for what they are. We have saved lives. You know, yes, we have lost people. We have lost about 1,300 people so far. One prays that we don't lose any more. It is likely that we can lose some more. And it is likely that we will lose some more before this war is over. But we have saved lives. And I think it is so important for us to keep that track and to say if we can save some more lives, it is all worth it. Let's keep fighting.
So how reasonable?
And it is not, and by the way, Jeff, it is not Mutahi Kagwe fighting. It's Kenyans fighting. It's not my war. It's our war.
So how reasonable, having said that, is it to reopen schools on January the 4th, given the present rising numbers? How reasonable is that?
We have said, and I think I said it in a press conference the day before yesterday, we have said we target periods when we want to reopen schools. But we also watch the situation, all right? It is not cast in stone that on day X we must open schools. If by day X the situation is not improving, or in our estimation, then it is not worth opening schools, and we are endangering our children, then you don't do it. Okay? Then you don't do it. Then you withdraw, and you tell Kenyans the truth. Well, we are targeted to open in January or in December or in wherever, but the experience we have had is such that we can't do that anymore. And Jeff, you see, the danger of the young people is not that the young people are essentially themselves going to die, because the experience we have had with the disease is that the asymptomatic nature of the disease among the children is very high, almost 99% of it. Even when they fall sick, you can't even tell, and they are fine. The problem is those who have got comorbidities, in other words, those who have underlying issues, they have heart issues, they have all sorts of other challenges that kids may have or people may have. Now, when they have got those challenges, then it is a threat to their lives. That's number one. But number two, more importantly, is that they are carriers. And then they bring it home. And then once they are in your house and you are above the age of 45 and above, or 50s and to our ages, then there is a problem. Then you have a challenge. So what we are saying is that it is not a one-way affair. And then let's not forget, these are our children. We are the same people you are referring to who are in bars. So it is not a one-way traffic. Even when they are at home, as long as you are going to the pubs and getting infected there, they can still get infected. So there is a whole cycle to consider, and not just one thing.
It's a tough call. It's a tough call. Just like the other day when you talked about vaccines. I mean, what were you thinking when you said, we're not going to consider vaccine unless we get scientific knowledge, unless we were really sure? What was that about?
Let me tell you, it is not what it was about. It is not in the past tense. It is in the present tense. Because even as we speak, other new people are coming with vaccines. I don't know whether you saw the report just before I got here, the one on CNN, the one that was talking about a new Chinese vaccine as well. Oh. All right? And we're talking about
Pfizer, there was Moderna.
There is Pfizer, there is Moderna, there is Abbott, there is so many other vaccines that are coming out from everywhere. We are also working on ours as Kenya. In Kemri, welcome. Trust, we are combining ourselves to work on a vaccine as well. Let me explain myself once and for all. We want a vaccine yesterday. All right? We want to get a vaccine yesterday. All right? And the sooner we can get it, obviously the better, because we will save lives. But we are also not going to fall prey to commercial operations that are essentially supposed to make money, treat us as guinea pigs in trials that have no efficacy and that have not been even tested by peer groups, so that somebody comes and says, I've got a vaccine. Before you know it, you are rushing there. Before you know it, people are dying away. Don't forget there has been other vaccines before that have come up. AstraZeneca came up with a vaccine that is still in use. They had to withdraw it at some point because of the side effects that these vaccines were having. So all I'm saying and all I'm telling Kenyans is, yes, let's be happy, that there are vaccines coming up. But let's not be the guinea pigs. That's it. That's all. And I don't think, Jeff, you have an argument with that.
No, I don't want to be anyone's guinea pig, that's for sure. You were talking about health reforms, right? Are we on the right track here? Because it seems like, One administration comes in, they have their own set of reforms. Another administration comes in, they have their own set of reforms. What are your thoughts?
You know, Jeff, I started off earlier by saying that an important aspect of management, not just management of health, even management of anything else, private sector, public sector, I think an important part of management is to create a base, is to create sustainability so that beyond you, whatever you want to do is sustainable and can go on. I think it's important for us to appreciate what is it we have been doing. I mean, if you look at the NHIF reforms, for example, that we have carried out, which are the ones that have now created this new civil servants covers, which is now the one that is talking about UHC and universal health care. And in the new format, in the pilot project, for example, what we were doing is essentially taking medicine to a hospital and telling people you can go to a hospital, which was not sustainable. So in the new one, in the reformed UHC, what we are saying is that this is insurance-based, ensuring that every single hospital, every single institution can sustain itself through being used and then being paid by the insurance companies, like you do at Nairobi Hospital, or like you do at Aga Khan, or any other private institutions that are there. So these are new ways that we are looking at doing things. But more importantly is what we are doing at the ministry itself, in terms of policy, in terms of philosophy, and in terms of the way we want to look at life. You know, Jeff, we have changed, and I'm not saying that people have done a bad thing and that's why we were moved. The Ministry of Health over the last couple of months has probably moved 100 people, over 100 people, you know, to bring new thinking into the system. I've spent the whole day today talking about the reforms that we are carrying out, the new structures we are building in the ministry, in order for it to be in tune with a devolved system of government. We are talking to parliamentarians to talk about new legislation that must be done so that even the boards of directors that we have stop being very incestuous and become effective institutions that can advise, that can be useful in advice. And huge reforms that are going on there with working with parliamentarians, working with the health committees of the Senate, working with health committees of the National Assembly. So it is a holistic approach to the whole way that we handle health. More importantly is the understanding that we are not just thinking about treatment of cases. Health is not treatment. Health is not going to a doctor and getting treated. The first aspect of health is prevention, is ensuring that you don't get sick in the first place. And that is the aspect of public health and family health and primary health care. What does it mean? Primary health care means that we have got to work on hygiene. It's a health measure. You know, this whole thing, Jeff, that you can go to a meat-eating joint, the toilets are a mess, you know, and then you get sick and you're wondering why you got sick. When you get sick, then you start saying there is no medicine in the government. You know, there is no medicine in the hospitals. The government is not working. Had you gone to a place with a clean toilet and everything, you wouldn't be in that place, in that spot in the first place anymore, so to speak. Yeah. So what I'm saying is that, and we have seen it during this COVID period, by the way. We have seen it. For example, the disease burden has suddenly dropped. You know, pneumonia is not as bad as it has always been. When you look at the children who are getting sick, our kids are not getting sick. And even if you look at just the number of people who used to get colds in July, and you remember this July, you see there was a lot of health. You know, a lot of healthy people all over the place. Why? Hygiene, cleanliness, washing our hands, you know. The basics. The basics. Yeah. So this is healthcare reform. So it isn't some huge magnitude of something that is going to be happening out there. Right. It is the measures that we have to take to ensure prevention and then cure.
Look, the reason I asked you the question about reforms is because you come from the private sector and in the public sector. And when we come back from the break, I want to ask you, what's it been like? You are coming from the private sector and you come into this challenge, if you will. I mean, it must be a nightmare. And I'm not putting words in your mouth, but, you know, it must be a nightmare, you know, working in the public sector from where you come from. Let's take a break. And also your questions, I'm sure there are many. There are many. We'll take them. Keep tweeting at Koinange Jeff at Citizen TV Kenya, the hashtag JKLive. JKLive takes a break. We'll be back in a moment.